Have you ever looked down at the end of a long day and noticed your ankles looking puffier than they should? Maybe your shoes feel tighter than they did this morning. Maybe you've been brushing it off as too much salt, or standing too long, or just getting older. Here's what I want you to know today. Leg swelling is one of the most misunderstood warning signs in medicine. And while it's sometimes completely benign, sometimes it's your body sending you a message that something more serious is going on underneath. Today, I'm going to walk you through exactly why swelling happens, what the most common causes are, and most importantly, when it's time to stop waiting and get evaluated. Stay with me throughout the whole video because the section at the end could genuinely matter for you or someone you love. I'm Dr. Kabir Haricharan Singh, a physician who is board certified in both family and obesity medicine. And before we get further into it, here's a quick disclaimer. Even though I'm a doctor, I'm not your doctor. This is educational information only, not personal medical advice. Always discuss decisions about your health with your own doctor. Before we talk about causes, I want to explain something foundational, because once you understand this, everything else kind of clicks. Edema, the medical term for swelling, happens when fluid leaks out of your blood vessels and into the surrounding tissue. And there are four main reasons that this happens. The first is too much pressure inside the blood vessels. When the pressure inside your veins increases, fluid gets pushed outward into the tissue around them. This is called increased hydrostatic pressure, and it's behind some of the most common causes of leg swelling. The second is low protein levels. Proteins, especially one called albumin, acts like an anchor inside your bloodstream, keeping fluid where it belongs. When protein levels drop, that anchor weakens and fluid easily moves out. The third is leaky blood vessels. When blood vessels become more permeable, like during an infection or an inflammatory response, they develop leaks and fluid escapes into the surrounding tissue. And the fourth is lymphatic issues. Your lymphatic system is your body's drainage network, and it normally absorbs any fluid that seeps out of blood vessels and returns it to circulation. But when that system is blocked or damaged, fluid has nowhere to go and it builds up. So at its core, and in the simplest of ways, swelling is fluid leaving the bloodstream and not making it back efficiently. Now, let's talk about what actually causes this in real life. To make this simple, I've set these up into 5 major categories of leg swelling, and I organize them in a way that actually makes sense, because how the swelling presents gives you important clues about what's causing them. Category number 1, venous insufficiency, the most common cause. Your veins have a tough job. They have to push blood upward against gravity all the way back to your heart. They do this with the help of one-way valves that prevent blood from flowing backwards. But over time, especially with age, prolonged standing or sitting, or a history of blood clots, these valves weaken and blood starts to pool in your lower legs. Pressure builds up in the veins and fluid gets pushed out into the tissue. This is why venous insufficiency swelling tends to follow a very distinct pattern. It's worse at the end of the day, gets better overnight when your legs are elevated, and comes back again by the evening. Okay, category number 2, heart failure. When the heart isn't pumping effectively, or when it becomes too stiff to receive blood returning from the rest of the body, blood backs up in the venous system. That backup increases pressure, and that increased pressure pushes fluid out of the veins and into your legs. Think of heart failure as a backup problem. The hallmarks clinically are swelling in both legs, shortness of breath, particularly when lying flat or with exertion, and sometimes rapid, unexplained weight gain over just a few days. That weight gain is fluid accumulating in your body, and it's a significant warning sign. Moving on to category number 3, kidney disease. Most people don't realize how much stuff the kidneys actually do in our body. I lovingly tell my patients that they are like your mother. You never realize how much they actually did to keep things running smoothly until you moved out on your own. Sorry for the tangent, but with respects to edema, the kidneys play a role in influencing fluid balance in the body. When the kidneys aren't functioning properly, sodium builds up, and where sodium goes, water follows. So that retained water increases pressure throughout the whole vascular system, causing fluid to leak out of the vessels and into the tissue. If heart failure is a backup problem, think of kidney disease as a retention problem. The swelling pattern can look similar, often involving both legs, but the underlying driver is completely different, which is why it's important to find what is the underlying cause. All right, category number 4, liver disease. The liver produces albumin, which is the primary protein that keeps fluid anchored inside your blood vessels. When liver disease is advanced, it reduces production of albumin, and that anchoring effect weakens and fluid leaks out of the vessels and into your tissue. With advanced liver disease, this can cause swelling not just in the legs, but also in the abdomen, a condition called ascites. If someone has swelling in both legs and a visibly distended belly, liver disease needs to be high on the list of causes. Finally, category number 5, local causes. This is an important clinical distinction. If someone has swelling in both legs, you're genuinely thinking about a systemic problem, like the heart, kidneys, liver, or venous insufficiency. But if the swelling is just in one leg, that changes things. One-sided swelling tends to point to a local problem, and the most important one to rule out is a DVT, or a deep vein thrombosis, also known as a blood clot in the leg. DVTs are dangerous because they can travel to the lungs and cause a pulmonary embolus, which is a clot in the lungs and is life-threatening. Aside from a DVT, there are other local causes including infections like cellulitis, an injury, or lymphedema, which is chronic swelling caused by damage to the lymphatic draining system. Most leg swelling, especially when it's been present for a while and is in both legs, isn't an emergency, but there are specific situations when you need to be seen immediately or go directly to an emergency room. Sudden swelling in one leg, especially if it's painful, warm, or red, needs to be evaluated urgently for a blood clot. Swelling that comes on quickly, along with shortness of breath or chest pain, needs emergency evaluation. That combination could indicate a pulmonary embolus, acute heart failure, or even a heart attack. Rapid weight gain, like several pounds in just a few days, alongside swelling is a red flag for decompensating heart failure or kidney disease. And a red, warm, tender leg, even without obvious swelling, can indicate cellulitis, which is a bacterial skin infection that spreads quickly and needs antibiotic treatment. Please don't talk yourself out of getting evaluated if you're experiencing any of these symptoms, because the earlier these conditions are caught, the better the outcome. I want to leave you with this because I think it's the most important thing I'll say today. The biggest mistake I see in practice is people treating swelling like it's the problem. They buy compression socks, cut back on salt, put their feet up, and they feel a little better, so they move on. And sometimes that's completely fine. But swelling is a symptom, not a diagnosis. The real issue is whatever is causing the fluid to leave the bloodstream in the first place. And if that underlying cause is heart disease, kidney disease, liver disease, or a blood clot, and you never address it, you're not just managing symptoms, you're missing a window to prevent something much more serious down the road, and an opportunity to treat something before symptom management is the only option. If your swelling is new, unexplained, getting worse, or comes with any of the red flags we talked about, please see your doctor so y'all can get to the bottom of it. To wrap things up, leg swelling comes down to one of 4 mechanisms: too much pressure, too little protein, leaky vessels, or blocked drainage. The causes range from very common and benign to genuinely very serious. If this video helped you understand something you've been wondering about, share it with someone who needs to hear it. And if there's a topic you'd like for me to cover, let me know in the comments. Okay, I'll see you in the next one.